everyone, welcome back to my YouTube channel, Happy Healthy Smiles. I hope you guys are all doing well. So today we are talking about gloves and masks, how to wear them properly and how to dispose of them properly. So since COVID-19 started, the international health agencies like World Health Organization and CDC, Centers for Disease Control, are recommending everyone wear a mask to protect themselves and protect others, especially in public places where it's difficult to keep a distance of 6 feet. Now, the reason they're recommending masks is masks help protect other people from your germs and protect you from getting other people's germs. So when you're laughing, coughing, sneezing, talking, small tiny droplets are released in the air and that could carry a virus. And also some people might have a virus and have no clue because they don't have any symptoms. So that's a good reason to wear a mask when you go out. Now, there's two kinds. One is this surgical mask, and the other ones people are making with fabric. Now, the fabric masks are great. They're cost effective, they're environmentally friendly, and they can be homemade or bought. If you're going to make a homemade mask, try to use one with cotton fabric. It's breathable, and try to layer maybe one or two layers of fabric and make sure it's comfortable and fits snugly. Now, on the website for Centers for Disease Control, you can find how to make a mask and with a fabric, and you can also find you can use a t-shirt to make it without sewing. And there's a third option where you can use a bandana with rubber bands to make it, and these are effective. Now, a couple of don'ts about mask is make sure kids 2 and under should not be wearing a mask. Anyone who has difficulty breathing should not wear a mask. And anyone definitely who's unconscious, don't put a mask on that person. And anyone who has trouble taking a mask off without assistance is not recommended to wear a mask. So let's talk about these surgical masks. A lot of people are wearing these, and you can find them at pharmacies or online. Now, unlike the fabric mask, these masks cannot be washed and reworn. They're usually disposable, and after maybe a few hours, most of the day, depending on how much you used it, you have to throw them away. Now, these come in different levels, level 1, level 2, and level 3. And that means how effective they are against aerosols and fluid resistance. In my description box, I'll put in exactly what that classification means. Now, for everyday use, for going to the grocery store or the subway, level 1 is more than good enough, and that's exactly what I use. Now, before you put the mask on, please wash your hands with soap and water 20 seconds. And if your hands are not visibly soiled, you can go ahead and use a hand sanitizer that is 70 to 90% alcohol based. So you grab the mask from the loops, and the dark part is usually worn on the outside and the light part is worn on the inside. Now, there's a bendable strip which goes on the top of the face and it forms around your nose. So I'm going to just go ahead and show you. Put it around, loop it around your ear, put the strip right over your nose, under your eyes, and make a snug fit. No gaps. And then pull the accordion all the way down underneath your chin. Here you see no gap, and voila, you are safe from people talking, sneezing, laughing in your face. So when you're ready to take it off, especially if you have gloves on, take your gloves off. Use a hand sanitizer. Even if you don't have gloves on, use a hand sanitizer. Clean your hands. Put your fingers in the loops and take it off. Now, please don't touch the outside part because that usually is contaminated. So you don't want to contaminate your face or your hands. Now, if you've used it and you're done with it, it can be gone. The disposable one is in the garbage. If it's your fabric one, keep a bag or a paper bag with you and put that in a safe place in the bag. Not on your car, not in your purse, and definitely not in your pocket. Now, a couple of things I just want to mention about wearing a mask. So when you're in the store, I see people adjusting it and touching the face and neck area. Make sure your hands are clean. Use your hand sanitizer. Adjust your mask. and you're good. Now, other thing, a problem I see is the mask down here. Now you see the problem is this is touching my lips all around. So anything that's contaminated here will be touching my lips. Same thing here. If you keep it here, this part is going to contaminate your neck, your chin area. Same thing if you put it here. First of all, it's not effective and it's going to be contaminating your mucus area. So that's where you want to be careful. So always have the mask over your nose, your mouth, and your chin. Another thing I want to mention is when the mask becomes wet from sneezing, coughing, or splatter or whatever, is not effective. So basically, you're done with the mask, grab a new one and use that one. Now, this is all for mask, and we'll talk about gloves. All right, so we're going to talk about gloves. A lot of people are wearing these. Um, I find they're really not necessary. Actually, the mask is much more necessary than gloves. If you are going to wear them, just remember now they're going to be getting dirty because you're touching things, you're picking up things. So I see a lot of people touching their hair, their face, their lips. These are now contaminated, so treat them like contaminated hands. And I find it gives you a false sense of security actually. So just be careful when you have gloves on. And when you take it off, you pinch from here, take the whole glove off, and then grab it from this end, and then put your fingers underneath, and you've got all in one, and dispose of it. And then you make sure you use your hand sanitizer after. Instead of gloves, I would prefer just a hand sanitizer, and you can use it so much more often. If you want to wear gloves, make sure you have a few pairs because you want to be changing them quite often. Don't be wearing the same pair pretty much all over the place. Now that's about it for all these lessons. I hope that helps, and keep healthy and keep safe, and hope to see you back soon. And please subscribe and hit the like button, and I'll see you soon. Bye.